Hello everyone, welcome to my channel Daily Drug Info, and don't forget to subscribe Daily Drug Info to watch new videos. Today I will describe drug Labetalol. Overview and indications. Labetalol is a selective alpha blocking and non-selective beta adrenergic blocking agent with weak intrinsic sympathomimetic activity, no membrane stabilizing activity, and moderate lipid solubility. It is effective in treatment of hypertension, hypertensive crisis, angina, and post-myocardial infarction hypertension. Dose: IV bolus dosing in 20 mg over 2 minutes with repeat injection of 40 or 80 mg given at 10 minutes interval up to 300 mg. Continuous infusion 2 mg per minute with effective dose usually in a range of 50 to 200 mg. Pediatric doses 0.2 to 1 mg per kg IV bolus up to maximum of 20 mg followed by continuous infusion of 0.78 mg per kg per hour. Range 0.25 to 1.5 mg per kg per hour. Maximum 3 mg per kg per hour. Strength available in injection 100 mg per 20 ml. Adverse effects are hypotension, dizziness, and nausea are common side effects. Aggravation of airway obstructions can occur in asthmatic patients. Labetalol therapy should be discontinued in patients who develop laboratory or clinical signs of liver injury. Thank you for watching Daily Drug Info.